Hi, I'm Dr. Meredith. Welcome back to Pupwell's Back to School. Yesterday we talked about dogs and their skin and common conditions that we see with dogs and their skin. Today we're going to talk about ears. So ears are the perfect follow-up to a discussion of skin because ears are considered skin. And conditions that we see with the ears are also typically related to conditions that we see with the skin. Like allergies. So ear infections are very common. See them feels like every day, especially in areas. So I'm in Louisiana, so I practice in Louisiana. I've been in Texas as well because the environment's so humid. There's a lot of moisture. A lot of dogs like to swim. There's lakes and all sorts of things, and people have pools. We see lots and lots of ear infections. So very common, something that's seen kind of on a daily basis, and we do look for. So ear infections should not just happen though all the time. So dogs that are coming in for repeat ear infections, we do want to consider allergies. And like I talked about before, that typically is related to the skin as well. So skin allergies such as food allergies, environmental allergies, or seasonal allergies can show up as ear infections. So I have some patients that seem to come in every time spring comes around, they come in for an ear infection. Or, they might be more of a fall allergy. So fall comes around and they come in, with ear infections. And that's really good to know that and recognize it so that you can kind of stay on top of it, do more frequent ear cleanings if you know that your dog has some seasonal allergies, which a lot do. So first off, kind of just talking about anatomy of a dog's ear. So I drew a picture. It's not the best one, but I explain this a lot for clients because, what we get worried about with the ears and when people, are dealing with the ears at home, we're always so nervous that we're going to hit the eardrum. But dogs and their ear canals are actually very different from ours in terms of their anatomy. So this is kind of the outer flap of the ear, so we call that the ear pinna. And then what we have is the vertical ear canal, so it goes down. And then we have the horizontal ear canal, it goes to the side. This is the dog's nose. So this is going in, and then the eardrum sits all the way down here. So with humans, our ear canal just goes horizontal. There's no horizontal and vertical. There's just the horizontal ear canal. So for dogs, when you think about, going to clean their ear, a lot of times people worry that they're going to hit this eardrum, and really, unless the dog has inflammation, infection, already present in the ear, then the likelihood that you're going to hit the eardrum is very, very low. So it's something that I explain to people all the time. It's not something I would worry about. It's not like when we go to the doctor and they say to be really careful, not use Q-tips too deep or anything because you can rupture the eardrum. And that's true in us. But for dogs, we do want to clean these ears really well. And what we see is, this is typically where, everything gets kind of gunked up and built up, is at that kind of turn of the vertical to the horizontal. So that's a good thing to keep in mind. I said the risk is very, very low that you're going to hit an eardrum. And like I said, if it did, it was probably going to happen anyways because there's inflammation and infection. And in that case, you really should be seeing the veterinarian if they're that painful and that uncomfortable. So a few common mistakes that I see people make is choosing the ear cleaner. So ear cleaner, it is something that I recommend getting at your veterinarian's office because there are a lot of over-the-counter. You can get them on Amazon, you can get them on Chewy, and that's all okay. It's not going to hurt the dog, but it might not be the best option for them. So just an example, this is what I use for our golden doodle puppy, what we've been using, and I would show you how to clean the ears on him, but he's a little not quite used to it yet, so we're working on it. But this one is ear cleansing, and what you want to look for is that the active ingredient there's salicylic acid in there. So salicylic acid is the drying agent. You always want to have a drying agent in the ear cleaner, because if you don't, that leads to moisture buildup in the ear. That ear cleaner just sits there and could potentially create more problems. So try to get it from a veterinarian. It's really not that expensive. This was, I think, like $15. Like, it's worth it, in my opinion, to get something from the veterinarian, especially if your dog has a history of ear infections. And there are some kind of more medicated ear cleansers that actually really, break down that debris. And of course, they all dry it out. But there's some that also are like antimicrobial, antifungal for dogs that, do get bacteria and yeast overgrowth in the ear. So the other mistake I would say that we see is not cleaning frequently enough, or even just not looking down in the ear. So, it's funny, some people will bring their dogs in and be like, oh man, they just stink. Like, I don't know what's going on. And, it's either the teeth or the ears in most cases. So a lot of people don't know to flip that, little flap, that ear pinna up, and look down in there. And if you see red, if you see gump, if it smells, that's reason to get, to your veterinarian and get them seen. If it's a little waxy, you can go and clean and be fine with that. So not cleaning frequently enough. They really need to be cleaned on a regular basis, or at least like looked at. So flip that flap, flip the flap up, take a look down in there, smell it if you want to, and make sure that it looks okay. And then really they need to be clean. I like to clean them once a week. That would be ideal. I know that's not always possible, but definitely after baths, unless you're really good about holding the ear canal shut and not getting water down in there. So after bathing, dogs that swim, really anytime they swim. And like I said, the good thing about these is, these drying agent ones, for dogs that swim, if you at least just squirt it down in there and they shake their head, then that's going to take care of kind of drying those ears out so they don't stay moist and then get, infections. So also, the other common mistake would be not wiping out the debris that's in the ear after cleaning them. So some dogs, if there's not a lot of gunk or anything, you can just, squirt it down in there, let them shake their head, and you're fine. But a lot of dogs will get waxy gunk down there. Dogs that are prone to ear infections, you should be really wiping the debris out. And if you don't feel comfortable, even after kind of seeing like, okay, that ear canal, the eardrum, that's not, something that's likely that you're going to injure or damage, then always, go to your veterinarian or even your groomer, if you like. And I know they'd be happy to kind of show you how to do it. I typically use cotton balls and kind of roll them up in between my hands, and kind of depends on the cotton ball. Some of them are really great for us, some of them aren't. And then I do use Q-tips. I said I'm not worried about hitting the eardrum. I'm comfortable if you go straight down, you're not going to hit the eardrum. Okay, and then if the ears are red, inflamed, that definitely could be a sign that there is an infection, an ear infection, which the medical terminology for that is otitis externa. So that means the external ear canal is inflamed. That could be from infection, so bacteria or yeast, or it could just mean inflammation, in which we do sometimes dermatologists are starting to notice more now, is that sometimes you don't need to do like the antibiotics and the antifungals. Sometimes they're just inflamed, and sometimes they just need steroids or something like that to kind of calm down that inflammation. So that's kind of interesting, kind of how we treat ear infections. And it depends on your veterinarian as well. There's some long-acting treatments that I really like for people that just, can't clean their dog's ears at home, or they're really painful. Or sometimes we'll do a little round of steroids first just to get the inflammation down, so that they'll let us touch the ears, because these are painful. painful ears that we do see, and some dogs even have to be sedated to get their ears done. So if you work with them, get them used to the ear cleaner, pay attention to the ears, kind of try to catch those ear infections before they get to where the dog's just miserable and like it stinks and it's bad. For our doodles as well, those ear hairs, you know, a lot of times those do kind of trap all your debris in the ear. So it is important to get with your groomer, or if you feel comfortable doing it at home, plucking those ears as you feel comfortable. So if you do notice that the ears are red inflamed, infection, if you notice that you clean the ears and the debris comes right back, then that could be another sign of ear infection. So would recommend seeing your veterinarian. I said some will do ear cytology, so we get a swab, put it on a slide and look at it under the microscope, and that tells us if there's bacteria, yeast, and kind of how to treat that. But that depends on your veterinarian. You know, what we commonly see is bacteria and yeast. So some would treat, you know, empirically. So, but that is it. Like I said, ear infections, so common. Make sure and look down in that ear. All you have to do is kind of pull that flap up, look down there. If it looks gross, probably needs a good ear cleaning. You know, and if you notice if they're painful, is that those are very painful. Try to get those seen, you know, sooner rather than later. Those dogs really don't feel very good. So, but thank you again, and we'll talk to you later. Bye.